Here is the number one reason why you need to get a Medicare supplement policy if you are going to keep original Medicare. In order to make this make sense, I want to talk to you first about something you know. So you're either in group coverage or you have a marketplace plan. And typically what you're going to see with these plans is there is a deductible, let's say it's $2,000, and then there is a max out of pocket defined by the plan, let's say it's $5,000. So let's say you've met your deductible of $2,000, but now you have all these big medical expenses, and they're basically telling you you'll pay 20% of that cost until you've hit a total of spending $5,000, and then what you could spend is capped at that amount. And then you start over the next year. So now when you put it in the framework with original Medicare, what happens is under Medicare Part B, which is your coverage outside of the hospital, once you've hit your deductible, and in 2025 it is $257, then Medicare is on the hook for 80% of your bill. So with Medicare paying 80% of your bill, that leaves 20%. Now that sounds familiar to the example I gave you of 20%, but here is the difference. In your current plan, you have a max out of pocket you could spend. In original Medicare, that 20% is uncapped. So in other words, there is no max out of pocket. So if you have a $10 bill, a $1,000 bill, a $10,000 bill, a $1 million bill, you owe 20%. And that is the job of the supplement. So you get a Medicare supplement policy to either cover 100% of that 20% or at least part of that 20%. If you do decide instead to go into a Medicare Advantage plan, those plans do define a max out of pocket, but now you're choosing an alternative to original Medicare. So it's just something to keep in mind when you're making a decision which path you want to go. But in original Medicare, you're going to want to get that Medicare supplement policy to protect your retirement.